If you're a dental hygiene student struggling with head neck anatomy, this video is for you. Today we're going to be talking about the trigeminal nerve. This is the dental favorite. It's the largest cranial nerve because it has 3 branches. Trigeminal, three. It has ophthalmic, maxillary, and mandibular. Those are the 3 branches to remember. Ophthalmic is sensory only and it innervates the eye, scalp, forehead, and upper eyelid and inserts through the supraorbital fissure. That's all you really need to know. Then we have maxillary. This is sensory only. This narrows down to everything in the maxillary. It inserts into the foramen rotundum and goes through the pterygoid palatine fossa. This second branch basically innervates PSA, MSA, ASA, IO, NP, and GP. So the PSA, that basically blocks the maxillary molars, except the mesiobuccal cusp of the first maxillary molar. The MSA, that blocks the maxillary premolars and the mesiobuccal cusp of the first maxillary molar. Now that's the posterior, and because they don't block the palate, you need a GP, the greater palatine. That blocks the lingual of the maxillary molars and premolars. You mostly want to say palate rather than lingual, but either way, they'll know what you mean. Okay, now we have ASA block. That blocks the facial anterior teeth from canine to canine, but just the facial and the deep. That leaves the palate, so then you need an NP, a nasopalatine, and that gets the palate or lingual of the anterior incisors, maxillary anterior incisors, canine to canine. Sometimes what also happens is we do an IO, an infraorbital. This is a combination of an ASA and MSA. This numbs the incisors and premolars, plus the facial soft tissue. Now we have the last branch, mandibular, which is sensory and motor. This nerve inserts through the foramen ovale and numbs all of the mandibular. We have an IA, a lingual block, a long buccal, mental, and incisive. Starting with the IA, which is the inferior alveolar. This can basically numb all the way up to the midline of the anteriors. If it doesn't, then you do a mental and incisive block. Also, in addition to an IA, you have to do an LB, a long buccal, because that gets the buccal of the gingiva of the mandibular molars. And when you're doing an IA, sometimes you have to go a little more outward, so you're in when you're anesthetizing and you come out just a little bit and get that lingual nerve. That kind of blocks that floor of the mouth on that half, anterior 2/3 of the tongue, and the lingual gingiva. So that mental block doesn't block any of the anterior teeth. It blocks the premolars, the chin, the lower lip, and facial gingiva of the anterior teeth. But the one that does anesthetize the anterior teeth are going to be the incisive block. You're going to inject the mental and push in so that that anesthetic can go into the incisive nerve. The way you can think about which one is which, incisive is on the inside, on the incisors. The mental, M for mucosa, the tissue. I hope that helped. Have fun studying. I'll see you later. Bye.